Good day, viewers, and welcome to today's COVID-19 update with Minister of Health, the Honorable Dr. Frank Anthony. Dr. Anthony, as we begin this morning, let me first congratulate you and the Ministry of Health for having more than 100,000 doses of vaccine administered to persons. Congratulations on that. How are we with vaccines as of now?
Well, first of all, thank you for your congratulations. But I think the people who we need to congratulate are those who have been actively working across the country to make sure that people get their vaccines. And those persons include the staff of the Ministry of Health. We also had members of the Joint Services who've been working tirelessly with us, and along with many volunteers, without whom this would not have been possible. So I want to thank all of them for their assistance, and we hope that they continue working with us as we work towards the goal of reaching herd immunity sometime during this year.
There have been some questions raised regarding blood clotting from AstraZeneca vaccine. As a medical doctor, can you provide some clarification on this issue?
So there were a few cases of clotting when people used the AstraZeneca vaccine. However, the vaccine was stopped in many countries. The use was paused in many countries, and investigations were done. The World Health Organization, for example, through a body called SAGE, which comprises of experts at the WHO, review this vaccine, and they have concluded that the benefits of the vaccine outweigh the risk. We have had a number of other expert entities that have reviewed the vaccine, such as the European Medical Regulatory Authority, and they concluded similarly that the vaccine, the benefits outweigh the risk. In the UK, a similar assessment was done, and again, that was the conclusion. The AstraZeneca vaccine is right now used in many countries, and because the benefits outweigh the risk, those countries that have initially put a pause on the vaccines have now restarted, most of them. There are a few, however, that is still reviewing the data, but that's the choice of individual countries. We in Guyana, we have used AstraZeneca vaccine initially in our campaign because we received these doses from Barbados as a donation from the Indian government and from COVAX. And we were satisfied that when we used it in Guyana, we did not have any cases of blood clotting, and we have been monitoring for these cases. So we are very pleased with the results that we have had with these vaccines so far, and we'll continue to use them. So persons, many of the persons who received the first dose would be due for their second dose of the AstraZeneca vaccine maybe in a month's time, and we encourage them to come and take their second dose.
Why is it important to take that second dose? And can you emphasize and maybe give the viewers some idea of the importance of having that done?
So with when you get a first dose of a vaccine, it starts stimulating your immune system to produce antibodies. And after a certain time, those antibodies can drop a little bit. So with a second dose, the second dose makes sure that the level of the antibody in your system remains at an acceptable level, which means that if you come in contact with the virus, your immune system would recognize this virus very early and would react to defend your body against this virus. And that's the purpose of the vaccine, to ensure that you're immunized, your immune system is prime and ready, so that when the virus, when you're exposed to the virus, that it can destroy the virus very quickly.
For a person who has received his or her first dose but subsequently contracts COVID-19 before the second dose, what's the Ministry of Health's policy with respect to administering of the second dose, and what time frame?
So because we're using different vaccines, it would have to be specific to the different vaccines and the time period in which you might have gotten your infection. So let's say hypothetically, you have your first dose, you're due for your second dose after 28 days, but you, for whatever reason, you got COVID, 2 days after you got the vaccine. It would mean that we have to wait until you have recovered, which generally in the mild cases would take about 10 days. So you would still be within the time frame to get your second dose because you would have completed your recovery between when you got your first dose and when you were due for your second dose. If, however, having received your first dose, and let's say maybe on day 20, for whatever reason you got infected, then that 10 days to recovery, from exposure to recovery, would take you beyond the original 28 days interval between the two doses. And in that case, what we would advise is that people wait until they have recovered fully, and then you come for your second dose, and in this instance, in this particular case, it would be just a few days. And so that's the formulation that we have been using because if by chance somebody gets an infection of COVID after your first dose, we want that person to be fully recovered before you get the second dose.
As we expand the vaccination drive, could you shed some light on private institutions that are allowed to do vaccination as well and whether there's a cost attached?
So we have been working with, basically in terms of this vaccination, the ministry has rolled out vaccines using the public health system, meaning health centers, hospitals, and so in the public health system. And we have also partnered with a number of NGOs, faith-based organizations and so forth, to be able to roll out vaccines in different communities and going to non-traditional places for health. So maybe a primary school or a community center or mandir or a mosque or a church. So we have been partnering with different agencies to do that. We have also partnered with all the private hospitals to work with them, and the ministry would be providing the vaccines to these private institutions, and they in turn would administer the vaccine to their patients, to people who want the vaccine, who feel more comfortable going to a private institutions, to these private hospitals. And once they receive their vaccines there, the health staff of those hospitals would take the relevant clinical information that we need, and they would be able to issue the card that we are giving to show that people would have received their first dose. So this is a partnership between the Ministry of Health and the private hospitals, and so far it has been working well. We are hoping that we can ramp up how many people go to these institutions. And so that is something that we are reviewing right now to see how we can get more people visiting these different vaccination sites.
Okay, Minister, there's some hesitation in seeing Region 1 here, where persons, probably because of some myths that they're hearing of. Can we explore some of these and give us some answers?
Sure.
Myth number one, that the vaccine is a ticking time bomb and it will explode sooner or later.
Well, we all know that vaccines are not time bombs. Vaccines have been proven to help to eradicate diseases. We have had those experiences with a number of vaccines with childhood diseases. And because of those vaccines, literally millions of children's lives have been saved. So we know that vaccines work. And in this case, with the COVID-19 vaccine, it has been very protective. It has served to reduce infections, reduce hospitalization. And for most of the vaccines, they're 100% protective to prevent people from dying from COVID. So there's nothing like the vaccine being a time bomb.
Okay, myth number two, the vaccine is the mark of the beast, the number 666.
Well, I don't know how, how people would have formed such an opinion. The vaccine has no mark on it. The only mark that you find on the ampoule is the mark bearing that of the name of the vaccine and its expiry date and so forth. So that obviously is some fabrication that someone would have come up with.
That the vaccine would paralyze you.
These vaccines don't paralyze anyone. The reaction that people would get to these vaccines would be those that you would expect with any vaccine. If you get an injection, at the site of the injection, some people will get pain. In a couple of hours, some people might get a little bit of fever, a little bit headache, some fatigue. Those are the typical symptoms of when someone gets a vaccine. And we have seen that with the people who we would have given vaccines to. And then there are some people who don't get any signs or symptoms at all. So, for example, like when I got my vaccine shot, I didn't get any signs or symptoms. I didn't get a fever, I didn't get a headache, nothing. So I think people should just come out and get the vaccine. We also monitor for what is called adverse side effects. And we haven't seen any in Guyana. And so we have a special committee that has been put together to monitor these effects, not only locally, but we are part of a global network where we can get information if such things occur.
Myth number 4, the vaccine would make you impotent.
Again, this is another myth. There's no findings to show that these vaccines make anyone impotent. And in Guyana, as we've just said, we've administered these vaccines to more than 100,000 people. None of that has been reported. But globally, millions and millions of persons have received this vaccine. In fact, the WHO has reported that more than 900 million people so far globally have received different types of COVID-19 vaccine. And there's no report in any one of the scientific journals or literature that says that these vaccines would make you impotent. So that's really a myth.
Okay, and the final one for today, that the vaccine would actually give you the COVID-19 disease.
How vaccines are designed, they're designed to stimulate the immune system without giving you the disease. So with all the vaccines that we're using, they would have a small piece of the virus, but that piece cannot give you the disease. It is that little piece is used to trigger your immune response, but by itself cannot give you the disease. But that's how vaccines are generally designed. And in this case, these vaccines would stimulate your immune system without giving you the disease.
Okay, well, thank you, Dr. Anthony, for talking with us this morning and for clarifying some of the rumors that are going around, the myths. Thank you very much. And viewers, thank you. This was our COVID-19 update for today, April 22, 2021. I'm Natasha Smith. Thank you for watching.